We'll talk about different strategies and techniques. So, you guys, we're going to do another open discussion, and then we'll do another multiple answer question about some techniques that could be utilized. So, for our open discussion question, how can we as therapists keep the client engaged and effectively conduct the session? Open discussion, great examples. I really like that. Perfect. And now for our example. So during a session, you're working with Samantha, and she has a history of engaging in headbanging whenever she has to transition between an activity. Which one of the following techniques do you think we could utilize to avoid her engaging in problem behavior? A, nothing. She has to get used to it. B, have her mom tell her it's time to clean up. C, use a timer and let her know she has 2 minutes before you clean up and go on to the next activity. Or D, use a first dim board along with a timer to let her know she has 2 minutes before cleaning up and going on to the next activity. So, the best answer would be D. How many of you all thought it was C? C is a really good answer because it is perfect to provide your client with a warning about an upcoming transition. However, D would be the best answer because you are providing Samantha with both a visual aid of the next activity as well as a timer to warn her when the transition of the next activity would occur. Any questions? No? Okay. So, what can we do? You must always be mindful that we need to be sure that we provide our clients with appropriate and functional opportunities to communicate and learn and eliminate the opportunity for problem behavior. As we have discussed, there are 4 functions of behaviors, but make sure you always consult with your PC about which one technique would be most effective to utilize with our client, because as we know, behaviors can have varying functions. Do you guys remember what the 4 functions of behavior are? Yes. Perfect. So some PCs may have you to implement programs where PECS cards or sign language is taught to assist the client with a functional way to communicate their wants and needs. For example, it would be suitable to use PECS cards with a nonverbal client who often engages in a very severe tantrum due to their inability to communicate that they need a break from work. Another example could be utilizing a DRF, which, as you can recall, means differential reinforcement for other or omitted behavior. This could be utilized for a client who often engages in elopement from the table during math homework because they're trying to avoid the task. You will provide reinforcement for the client for sitting appropriately for a specific amount of time. Social stories are also good to utilize with our clients to assist them with learning how to participate in their environment with situations that may cause them anxiety or discomfort, such as playing with others on the playground or understanding emotions. So then we will go into a quiz which we have for them, which are videos that are going to demonstrate different characteristics of ASD, and we're going to show them the videos, and for each one we want them to identify the behavior that is being shown as well as what category it would be under. So I hope you guys were paying attention. And then we want you guys to collectively come up with 2 examples of a technique or tool that you think would be effective to use to eliminate the opportunity for problem behavior. Any questions, comments, concerns? That's it.